Welcome, everyone, to the National Alliance to End Sexual Violence and RALIANCE Sexual Assault Awareness Month policy briefing on rape crisis centers and survivor needs during the time of COVID-19. We're so glad that you could be here with us. We're going to get started in just a second as we give people a chance to join. And let's see, I think we've got everyone on mute, so we're going to ask that you stay on mute. If you have a question or anything, you should feel free to put it in the chat. We're very glad to have our speakers with us here today, and I'm going to get us started and also pass it over to Ebony for a welcome and a very brief PowerPoint, and then we will be turning it over to our very esteemed speakers. Yeah.
Thanks, Terry. I'm sorry, I thought you were passing it over to me.
Oh, no, great.
Okay, great. Thank you. I will be very brief. As Terry said, I'm Ebony Tucker, the Executive Director of RALIANCE. I just want to say thank you to everyone for joining the briefing today. We're so excited to have so many people join us, advocates, survivors, staffers, our policy partners. It's great to have you all on. I just want to say quickly that we will be providing a video of this briefing as well as some really important COVID-19 resources on RALIANCE's website in the coming days. We hope that this will be really beneficial to the work that you're doing and that you are able to find them there at RALIANCE.org. So thank you again for joining. I want to take a second just to thank this amazing expert panel. We're so fortunate to have them on today. And with that, I will pass it back to Terry to get us started.
Great, thank you so much. And of course, I should have introduced myself. I'm Terry Poore, the Policy Director with the National Alliance to End Sexual Violence. And while our office is in Washington, D.C., I'm coming to you from my home in Tallahassee, Florida today, and very glad to be with you. Of course, we all expected our Sexual Assault Awareness Month events to go a little differently. I know everybody's events have been derailed by COVID-19, and we really hope that you and your families are safe and well during this time, and we're grateful to be able to have this time with you. So we were planning to do an in-person briefing later in the month at the Senate. You know, the primary audience for this briefing are Hill staffers, congressional staffers. We're going to be talking about our asks for COVID-4 for rape crisis centers and survivors. But we know we've had a lot of local programs and other partners join today, and we're so happy to have you all with us as well. Megan will share in the chat our 2020 infographic on the funding needs of rape crisis centers. However, that was the infographic we did before COVID-19 hit. And so we're updating those materials now, and we're going to really focus today, although we continue to work on our appropriations asks for FY21, we're really focused today on the impact specifically of COVID-19 on survivors and the work that we're doing. We want to just thank the advocates, so many of whom are with us today, for your ongoing work. We know that programs remain very passionate about getting survivors the support they need during this very difficult time. And so we just really appreciate your work so much. Okay, so now moving on. So last week, we did a survey of local programs about the impact of COVID-19 on their efforts to meet the needs of survivors. And we heard from over 600 local programs across the country about their grave need for emergency funding to ensure survivors are not left alone during this difficult time of crisis. So what we heard was that 89% of programs said in order to meet the current needs of survivors, they would need additional emergency funding. 40% experienced an increased demand for services. And demand is sort of interesting and nuanced at this time because although 40% of programs are experiencing an increased demand, we also know that demand for some services like forensic exams and other things is decreased. And we've heard from a lot of programs that said, the ones that said their demand had not increased, that They also anticipated after this time that there would be definitely a swelling of need. And then, of course, when people are having a really terrific difficulty coping, sometimes they aren't even able to reach out for support. So we know that although 40% of programs have experienced increased demand, that is really kind of a nuanced issue. And then we heard from many programs who talked about the fact that this is Sexual Assault Awareness Month, the month they often have their signature fundraising events where they really draw from their local communities for private donations, and they've had to cancel those. So they're really feeling the impact of the loss of private funding right now as well. So in our survey, we found 3 major sets of needs. First and foremost, programs told us that they needed funding to purchase technology, everything from cell phones. Many advocates have their own personal cell phones, but they don't have a confidential work cell phone to talk to survivors, or tablets to do support groups or therapy sessions, telehealth, those sorts of things, as they're very quickly trying to transition to virtual services to keep everyone safe. And then the next thing we heard is that survivors really need emergency services, everything from food to assistance to rent. One program said they needed to rent a van to deliver food and supplies to survivors. And we heard from a lot of programs that they really need to provide survivors with prepaid cell phones, because many don't have access to plans where they can easily reach out and receive services. And we know that during these troubling times, people's coping skills are really pressed to the limit, so that those emergency services. And then we heard about the need to reach vulnerable survivors. So the need for culturally specific services, the need to make sure immigrant survivors have language access, have protections that keep them safe and able to seek the services that they need. We heard about the issues for homeless survivors and a number of different groups. So our specific asks as we move forward in this time when Congress is looking at a 4th stimulus package, first of all, we're asking for $100 million for the Sexual Assault Services Program to meet those emergency needs of survivors, to help programs get virtual services off the ground, and to meet the needs of vulnerable communities. So that's a program at the Office on Violence Against Women in the Department of Justice. A House letter just finished circulating that has 91 signers supporting our ask there. And there's a Senate letter that's currently circulating by Senators Murkowski, Klobuchar, and Casey. So Senate staff that are on the call, we certainly encourage your bosses to sign on to that. And then another key ask for us is assistance with the VOCA Crime Victims Fund. We know that so many local programs rely on the Crime Victims Funds to fund advocates' salaries and the main work that they do. Even before this crisis, we were having a real difficulty with deposits going down. And what we're hearing right now is that programs really need a waiver of the match requirement in VOCA, because those local private funding sources really are significantly down during this time. We need a VOCA match waiver. And then we need a fix to allow more of the funds that are being generated. As most folks know, VOCA is not a taxpayer source. It is, taxpayer funds do not go to pay for VOCA. It is funded completely on fines on federal cases, mostly white-collar crime cases. And so there are some of those fines currently that aren't going into the VOCA fund, so we'd like that fixed as well. And then we support provisions for vulnerable survivors, such as those supported by the Alliance for Immigrant Survivors. And I believe Megan is going to share with you some information about that in the chat. And additionally, we're going to share the results of our funding survey with you in the chat as well, so that you can access that. So without further ado, I want to get to our very speakers. First and foremost, we have Monika Johnson-Hostler, who is the president of the National Alliance to End Sexual Violence, a RALIANCE managing partner, and the executive director of the North Carolina Coalition Against Sexual Assault. Prior to coming to NC CASA, I think 2 decades ago, Monika was appointed by the Obama administration to serve on the National Advisory Committee on Violence Against Women. And in 2016, she was reelected to the Wake County Board of Education to represent District 2 on the school board. Then we'll have Rosa Beltré, Executive Director of the Ohio Alliance to End Sexual Violence. She began at OAESV in 2013 as the Advocacy and Training Director and became the Executive Director in 2017. Under Rosa's leadership, OASV has tripled in size from 4 staff to 17, covering all 88 counties in the state of Ohio. She has spent the past 20 years training, cultivating community relations, providing development to organizations and communities focused on fair housing, child abuse, sexual assault, volunteerism, financial literacy, and church call to action. So very glad to have her with us today. And then Mary Ellen Stone, who is the executive director of the King County Sexual Assault Resource Center. KSARC is a nonprofit organization and the largest sexual assault program in the Pacific Northwest, serving almost 5,000 victims every year. Ms. Stone has played an active role in changing the nature of sexual assault prevention, public policy, and victim response in Washington State. Because of her leadership, KSARC has become one of the country's leading resources for sexual assault victims, their families, professionals, and the community. And then we're also really glad to have Amanda Pace, the program director at Turning Points Network in Claremont, New Hampshire. She's worked there for 10 years, and in this role, she is responsible for the planning, development, coordination, and integration of activities for Turning Point Network's 2 key programs: direct services and prevention education. She is responsible for the day-to-day management of the program, supervising staff, and overseeing all aspects. Prior to her work at Turning Points Network, Amanda served in the United States Air Force. So we're so glad to have our speakers with us today, and I'm going to turn it over now to Monika. And it's possible that Monika's having audio difficulties. Why don't, Rosa, would you be willing to go ahead and then we'll circle back to Monika?
Yes, of course. I believe that you guys would have to unmute Monika
Maybe
directly.
that's what's happening. Let me check here.
I'll give it a few minutes and see, which would be great to have her start, but if not,
Yeah,
I'll be.
let's try and let's see what we got here. I know that because of a glitch on our end, she came in as a second Ellen, so I'm going to go ahead and unmute both of those folks. Sorry about that, Monika. Hopefully now.
Yes, you did unmute me.
Awesome. Sorry.
Thank you. And thank you, Rosa, for noting that. I was like, I'll just sit patiently. And so you figured that out. Thank you, Terry, and thank you, Ebony. Thank you both for putting this together. And most importantly, it is my pleasure to join you both as the executive director at a state coalition, but in this role, particularly as the president of the National Alliance to End Sexual Violence and a managing partner of RALIANCE. It is my gratitude I extend to all of you for joining us during these uncertain times as we continue to try to navigate not only providing direct services to survivors across the country, but responding to those who actually provide those services. It is absolutely my pleasure to have a coalition director, who you've heard, Rosa, will be joining us to speak to the work that our 50 states and 6 territories who all provide the same services as a state coalition that Rosa will speak to you about, which the National Alliance Against Sexual Violence represents, but also to hear directly from our frontline services that 2 advocates you'll hear that represent the 1,500 rape crisis centers across the country, providing those direct services. As Terry spoke about the fact that we put this survey out pre-COVID, but these are still very similar things that we're hearing, because ultimately, I think for me, what I want the public and members of Congress to really know is that survivors are still needing our services. And more importantly, it's important that we don't curb our response to survivors, but that we actually find new and innovative ways, which you'll hear from our frontline folks who are doing that, that we're talking about the need pre-COVID, but we're also going to be talking about what do those new services look like? What challenges and safety nets have survivors experienced during this time? And I bring up safety nets because what I will say to you as both looking at this from a national perspective, but also hearing from both state and local advocates, that we are experiencing a time in our country where we really have to look at what our safety nets look like. We are navigating survivors across this country during COVID-19 through housing crisis, how to support them for confidentiality if they still want to seek services, whether it's with a therapist or a local rape crisis center. How do we navigate that so that they still feel supported, but most importantly, that we're helping them navigate a crisis that often triggers their own experiences of sexual violence. It is my most humble opinion that the people that you'll hear from after me will really be able to speak directly to what we're experiencing now, but more importantly, remind us of what we will continue to need in terms of funding and support and services moving forward in this country. While services to survivors are starting to evolve and look differently, I also think that we have to evolve and look differently at how we're funding services and recognizing that there are no survivor needs that are the same, and that'll be even more pronounced after we come out on the other side of what I'm terming, and many of us are calling our new normal after post-COVID. And so it is my pleasure to turn it over to Rosa so that she can talk more clearly about the work of our state coalitions and what our role is in supporting survivors, but most importantly, how we're providing services to the frontline service providers that you'll hear from. And again, thank you for joining us, and we look forward to continue working with you all and providing the information and resources that you need to continue to support sexual assault services in this country. Thank you. And I'll turn it over to you, Rosa.
Thank you very much, Monika. A pleasure. So realistically, when we talk about the difference between a statewide coalition versus a direct service provider, every state, as Monika indicated, has a sexual assault coalition or dual agency. We are a nonprofit, non-governmental organization designated by the federal government, representing the state's rape crisis centers and advocating for critical public policy change and social justice at the state and national levels. In some states, the Sexual Assault Coalition and the Domestic Violence Coalition are combined into one organization. In other states, including my state in Ohio, these organizations are separate. As we understand that there is intersection in the work that we do, we also recognize that there are very distinct work that we need to do. Our role as a state sexual assault coalition is to serve as the main training and technical assistant provider for rape crisis centers on best practices in programming and administration. And we also advocate on behalf of rape crisis centers and the survivors we serve in public policy advocacy, efforts at the state and federal levels. State coalitions also lead the state public awareness efforts and support local rape crisis centers in engaging with diverse community survivors and service providers in their service areas. We understand that in order for us to do this work, we have to do it with an anti-oppressive framework, and that sexual assault and sexual violence is a form of oppression that is connected to support and is supported by other forms of oppression. This includes racism, sexism, also homophobia, xenophobia, amongst others. And as we are seeing right now in this unprecedented time of COVID-19, it is also deciphered in the format of lack of accessibility. COVID-19 has affected the way that we live, that we communicate. It has affected the way that we work, as well as providing services, not only to our local programs, but also to the community at large. For most Americans, normal routines have been turned upside down by the current pandemic. In these challenging times, we are navigating through uncertainties for ourselves, our loved ones, as well as our community, and we are grieving life in the way that we are used to know it. These are unprecedented times that actually require us to think of other ways that we can support our programs. The Ohio Alliance to End Sexual Violence in itself positions itself to lead 32 rape crisis centers within our programs. On March 25th of 2020, the Senate anonymously passed the Coronavirus Aid or Relief and Economic Security Act, commonly referred to as the CARE Act. The House of Representatives just passed the legislation when we saw that last Friday, but we have also seen that unfortunately, even with House Bill 197, as well as other formats of funding with small business loans and the PPA, that is not enough to cover the needs that we actually have, not only as coalition, but to be able to support the local rape crisis centers. Our centers are hurting. They are hurting financially. We can just close shop or work remotely, while survivors of sexual violence and interpersonal violence need advocacy. They need resources, they need accompaniment, and they need services. But we also understand that our local advocates and preventionists are also part of that survivor group. Ohio has 5 standalone rape crisis centers, 13 dual domestic violence and sexual violence programs, and 14 multi-service programs. In 2018, our rape crisis center served 22,464 survivors. They answered 30,888 hotline calls. 4,735 survivors received medical advocacy. 6,686 received legal advocacy, and 4,880 received counseling. We remain committed to our survivors, the direct service providers, and to the success of our programs as a whole. But we understand that accessibility is not there for everybody, that it is much more than just providing technology. Because some, not only survivors, but also the ones providing the services, do not have enough minutes on their cell phones, or we don't have accessibility to hotspots because we are in rural areas. That we also recognize that with the pandemic and understanding that right now that is the main priority, we have victims of sexual assault as well as victims of domestic violence not accessing services at the hospitals, because once again, their needs will always be beneath the needs of everybody else within the community. So we need to understand that even though we are committed, we need support, we need help, and we are hearing loud and clear that we cannot continue to cancel events. Our life has been turned upside down, but in these urgent needs, we need costs for softwares, we need the ability to have online education and awareness campaigns, we need the ability to also offer hazardous pay for those that are doing the frontline work and are still continuing to provide advocacy one-on-one. We also need to be able to answer hotline calls from home and have the confidentiality and privacy that is needed. We also need hotel vouchers for survivors who need to be quarantined, and at this moment they cannot practice necessarily the social distancing that need, or that they also might be presenting symptoms of COVID but unable to receive the services that they need. We need to understand that it is much more from Congress and the Senate to go ahead and give us a wave match or the amount of money that we need. We need a stream of funding, an increase of funding coming to us all the time. It is not enough. If we continue to lose funding with VOCA, we are going to go ahead and be back 20 years behind. Services are inadequate for underserved population. We need to be able to have rural hospitals with phones in every room or tablets that will allow for virtual advocacy during sexual assault forensic exams, because once again, it's about accessibility. We need to understand that several hospitals have moved the exam rooms to one that does not have access to a shower. So if a program could allocate money to be used for hotel rooms so survivors can shower and get a good night's rest in a safe space, we need that funding. We also understand that in this critical time, those checks are not coming in the process that they need. So survivors need money for rent, for transportation, they need money for food, they need money to continue to actually be able to do their work as they are considered essential work. Telehealth, teleadvocacy, teleresponse is not fix all We need to understand that we need also to provide one-time stipend to the staff to help with paying their homes and internet bills and services. And we need to have prepaid phones available for survivors for them to access the services. VOCA is critical for the work that is needed on the ground. And I personally have heard from survivors today, Rosa, I prefer to have a sexual transmitted disease than to go ahead to the hospital and get contaminated by COVID. That breaks my heart, because the message once again is, this is the pandemic, this is more important. We don't have space or opportunity, or you're going to be turned away. So we need that message to be changed. We need survivors to know that they are still going to be served. We need the programs to understand that we are still going to be here to provide with the services that is needed. And we need the Congress and we need funding to be able to continue to provide the service that is so critical and needed all around the 50 states. I am honored now to present Mary Ellen with us as she continues to speak about the services needed directly by survivors that are receiving direct services.
Possible that I need to unmute her again as well, so I will check on that.
Okay.
Oh no, there she is.
I'm good. Okay, thanks. Thanks, Rosa. I'm Mary Ellen Stone, King County Sexual Assault Resource Center. I want to tell you 3 things today. A brief snapshot of who we are and what we do, because I think that that's important for people participating to understand. I want to tell you what service delivery looks like now after COVID. And I also want to highlight, here's where we need help and here's where we're really struggling. So first of all, Seattle, King County, we are the first epicenter. We have been in a state of emergency imposed by our governor since February 29th. So we've been living with this for a while. We are a 44-year-old organization. For those of you on the East Coast, you will like to know that we are the size of the state of Rhode Island. So we cover a lot of area, including 39 separate police jurisdictions. I say this because it gives you a sense of the complexity of how we work. We respond to an average of 500 victims a month. We're really good at working with trauma and with stress, and we have a staff who's bilingual and multicultural. We are the main resource for sexual assault victims in our region. We entered 2020 with a 22% increase in the number of victims have reached out to us over the last couple of years. And I tell you that because it's important to understand we are stretched, and I know we're not the only one in the country, but we were entering the year really extended and feeling like we didn't have a lot of room or a lot of capacity. We are the front line. Well, I would describe us as the second front line. We don't do housing and we don't do health, but we're the second front line because we're working with people who are in high degrees of stress and trauma, anxiety, fear, post-traumatic stress disorder. That's our life. And we do that really, really well. All of that was before COVID. So now we're dealing with people who have stress, anxiety, PTSD, and the uncertainty of what's happening with their lives. Do I have a job? What's happening with my family? And not only are our clients struggling with that, but our staff are struggling with that. We're doing everything we can to keep our staff whole, but it's hard to work with people in crisis and trauma when your life becomes uncertain, when your life feels like I've got to worry about my child or my spouse or other loved ones. So it's a challenging time for us to be there for victims and their families. Let me give you a snapshot though, because I was talking to staff yesterday about this. We're all working remotely. We have for the last 3 or 4 weeks. And they were telling me about this situation where a father reached out. It's not unusual for us to hear from dads who found out that his 10-year-old daughter had disclosed to him that she had been sexually assaulted by somebody. They had a large extended family living situation. She had been sexually assaulted over a period of time by somebody in the household. The dad, being very protective, immediately moved himself and his daughter out, found a safer place, got an apartment, began the whole police reporting process, started to get connected to us for the legal advocacy piece. And then we're also lining his daughter up for therapy. We do trauma-focused therapy. All of our services are in English and Spanish. So that was all moving, and then COVID hits. So what happens? He loses his job. The daughter is pulled out of school because the schools are closed. They're struggling. How do we make the rent? They don't have good internet connectivity in the apartment that they're in. So things like online schooling are really not going to be an issue for this family. The daughter, and those of you who work with children know that kids often blame themselves or think that they cause a lot of things to happening. The daughter's blaming herself for, shouldn't have said anything, because then we wouldn't have had to move, and then we wouldn't be in this place. A real understandable reaction from a 10-year-old. We're trying to make this legal system work. In our communities, the courts shut down pretty extensively. Police are only taking emergency interviews or emergency reports. This wasn't deemed an emergency because it didn't happen the day before. It happened about 6 months ago. So everybody is in hold. Meanwhile, dad's struggling with, how do I support my daughter and what do I do with this? So we spent hours trying to figure out how can we move something in the criminal justice process. Again, we've got 39 police jurisdictions and 3 courthouses, so it's not an easy system to maneuver, but we're able to get something going there. We recently switched all of our services to telehealth, which was a big lift, but they don't have good internet connection, and the daughter is young, and that's going to be our struggle to have somebody for a new client coming in on telehealth with that. If we could have seen them in person, this would have been easy for us. This would have been right up the alley that we work. What we would have done if we could have seen them in person was intensive trauma-focused therapy for the daughter, strong parental support for dad, really experienced help through the criminal justice system. We would have been able to tap into other financial resources as needed if we were able to operate pre-COVID. But right now, that's really hard for us to do. So the best that we can do for this family is we have our specialized parent educators staying in close touch with dad, really providing sort of emergency, basic mental health first aid, how to keep him centered and grounded, how to do some basic things in place so that he can keep his daughter steady and he can keep himself focused. How to tie him, and then we're also spending time trying to tie him into existing financial resources because he really needs to stay in that apartment. We're continuing to push the legal advocacy piece in the hopes that at some point we'll be able to make some moves there. And really, it's like all we can do to keep this family stable and connected during what is trauma upon trauma. And you all know this, but that's our lives too. So let me end with telling you what we need. VOCA is a lifeline for us. We get a fair amount of funding from a number of other places. VOCA cannot be overstated. We need flexible funding. We need increased funding. We are facing mounting IT costs, which we did not budget. We are facing mounting personnel costs because our staff are home with families, they're home with their children, they can't work. We're paying them. We're trying to keep them connected so when we do open up, they're ready to respond. But we're putting in emergency leave, so we're facing mounting personnel costs. We are also looking at loss of revenue. 25% of our budget comes from the private sector. So that's alarming. And we're looking at state and local governments that need funding as well, because that's another source of our funding. So with that, I'm so proud of our staff and so appreciative of this opportunity to share what's happening in Washington State, and really urge you to advocate with your members for this is an opportunity to shore up what is a critical first responder system. Thanks so much. Oh, and I think that I'm introducing Amanda, or I'm turning it over to Amanda.
Yes, hello everybody. Can you see me okay? Thank you, Mary Ellen. Good afternoon, everyone. Thank you for the opportunity to speak today. Turning Points Network is a crisis center in Sullivan County, New Hampshire. We are a dual sexual assault and domestic violence agency made up of 2 components, direct services and prevention education. New Hampshire is rural. Unlike the resource center that Mary Ellen works at, the county I work in has a population of 43,000. Turning Points is one of 13 community-based crisis centers who each year provide free and confidential services to nearly 15,000 survivors of sexual and domestic violence. In 2018, the 13 crisis centers collectively supported over 3,000 victims of sexual assault statistically, including both men and women. I hear my internet cutting out, so I hope it will stay with me. Trained advocates offer support services 24/7, day or night, 2 p.m. or 3 a.m. This pandemic will not change that. Regardless of what lies ahead, advocates will continue to provide support services, they will partner with survivors, and together they will work on a plan for safety. In recent weeks, we have navigated some challenges. Our support services look different. An advocate may be responding to a call while sitting on the couch with their children in the next room, but they are still providing tremendous advocacy. Survivors are being heard, supported, their financial needs are being identified, and although we're finding creative ways to utilize resources, we need more funding to continue to provide services. From the minute we receive the call from a survivor or from a hospital, we are there to provide support. Just yesterday, a coordinator for a sexual assault program shared with me that one of her advocates stayed on the phone for 3 hours while the survivor was having a SANE exam. When a survivor leaves an abusive relationship, it not only is the most dangerous time for them, it's also a tremendous unknown. It's a leap of faith, financial concerns, fear they may lose their children, pressure from family, friends. Where are they going to go? How are they going to support themselves? Now, during this pandemic, that fear is intensified. Survivors are feeling isolated and scared. Combine that with the inability to connect with their support systems, and it feels incredibly isolating. Advocates are trained to respond, listen, and provide support any way we can. We partner with survivors, inform them of their options, and together we navigate next steps. Trust me when I say it's hard to be an advocate and not be able to provide services in person. We can't sit with a survivor, hold their hand, and wait with them. They are being supported and heard, but survivors deserve more than that. Crisis centers need your support. We need dedicated volunteers to help on the crisis line, and we need funding to continue to support survivors. For the past 14 years, Turning Points Network has hosted an annual walk called Stepping Up to End Violence. Each year, we raise between $70,000 and $100,000, and it's our largest fundraiser. This year, we made the responsible decision to cancel the event due to COVID-19. This is critical funding in this fiscal year that we depend on. Thank you for supporting survivors, hearing their voices, and supporting the amazing advocates all across the country providing amazing life-saving services. And at this time, I'll turn it back to Terry.
Thank you so much, Amanda, Mary Ellen, Rosa, and Monika for giving us such a clear picture of the need and also the commitment and compassion of advocates across the country. And to those advocates that are on the phone now, again, we are so grateful for the work that you do every day. It's so important. It's where I began in this work, and I understand how difficult it is, and I can't imagine what it's like right now, so thank you. To congressional staff, we appreciate you joining. We really are interested in knowing any questions you have, either now or in the future. I'm going to put up a slide that has my email so that you can email questions. Also, the chat is open now, so please feel free to let us know what questions you have, and we would be glad to try and respond to those. Yeah, so we really appreciate our speakers and really invite you to jump in on the chat, to contact us later, and we really appreciate the partnership with RALIANCE as well. So let me go back to the chat to give it a check. Yeah, Stephanie says that one point that she wanted to make is that numbers are low for them right now, but they're expecting a big boom in services once the quarantine is lifted. And we've heard that from many advocates and programs as well. And Heather asks, how are we getting the messages about our services out to those who do not have tech or phones? I don't know if any of our speakers is able to answer that question. And then I'll take this one first while someone's deciding if they want to take the question about getting services to those who do not have tech or phones. Someone asked me, can someone go into more detail about the VOCA match waivers that were mentioned? So the Crime Victims Fund, the Victims of Crime Act Crime Victims Fund, that's a federal funding source at the Department of Justice that almost every local program counts on for their advocacy services to hire advocates. But it's not just rape crisis centers, it's domestic violence programs, it's child abuse programs, it's homicide survivor support groups, it's victim advocates at law enforcement offices. It's a major source of federal funding for on-the-ground services. And it requires that programs have a match of other funds in order to get those VOCA funds. So whether it's maybe local government funds, or it's the fundraisers that you've heard our folks talk about to match those funds. And what we're hearing from local programs is they're really having difficulty making that match to use the VOCA funds. We felt this before COVID, but it's even stronger now. And we really want in COVID for Congress to do away with that match requirement so that folks can get the VOCA funds they need and use those in their local communities. So did one of our speakers want to tackle the question about what if survivors can't access remote services? And know that too, people are problem solving in the moment, so we may not have answers to all of your questions yet.
I'm online, or you can
Yes.
hear me, Terry.
Yes.
I don't have a good answer. We are very well known in the community. We get referrals from lots of different places. Right this minute, if a person doesn't have a phone and doesn't have internet, we're not putting our staff in doing in-person services. So I think if we can't talk with a person by phone or communicate via email, we're not able to provide direct services at this time.
So that is a real difficulty. Anybody else want to try that, or we can go on to another question too? There was another question in the chat about what can folks do, but obviously our main audience for this is Congress and wanting to make those changes in COVID-4. But the question is, what else can people do besides advocate for federal funding and legislative changes? And I would say donate to your local rape crisis center. They could certainly use it.
Right.
And yeah. So I hear from somebody that some folks are working on allowing text chat as a way for survivors to be in touch, another remote way to be in touch, but certainly a possibility. And somebody raised confidentiality concerns. I know those are real issues that local programs are facing, is how to do, and legal services, and everybody who deals with folks is trying to figure out how do we do this, but do it confidentially. And that's another expense, because obviously people have their personal cell phones, but that may not be confidential. So that is something that folks are trying to figure out, definitely in the moment. So there's a question, why do you think that there is a low volume of calls if IPV incidents have gone up? So we don't really have the data to show whether interpersonal violence has gone up. I know there's a lot of people concerned with people cooped up in homes that could happen, and it very well might. But I think that the thought is that some people are so overwhelmed that they are not yet reaching out for help, or they are not reaching out for help in this moment. So there's a lot of folks that think, when we saw that 40% of the programs we surveyed actually are seeing an increased demand, both in terms of new clients, but also in terms of more complex needs of ongoing clients. But also, we do, as I mentioned earlier, have a lot of programs have said that they expect there to be a very big onslaught of service requests when this immediate crisis is over. Oh, and Rosa, I'm sorry. I guess some of the speakers are still on mute, so let me.
That's correct, Terry. One of the things I did want to chime in on that we talked about as you unmute, Rosa, is that one of the things that and somebody actually put in the chat, is advertising locally about the change in services can be helpful. But the other piece, which Rosa did mention, is we've been supporting our programs that if they need to provide prepaid phones, so that does give survivors the option as a place to pick those phones up, to be able to use those for those survivors who may not have phone or internet access that's their own personal or confidential.
Rosa, you should be unmuted now.
Thank you. So also another way that for those in rural areas or that don't have cell phones, we actually created a list of strategies, and Chandra and Olivia, part of our staff, were so kind to go ahead and send this in reference to those technology strategies. So billboards and yard signs, sometimes this can be donated by companies who are in between billboard ads and they need to have something there. That would be a great way to catch people who are walking or waiting for transportation. There's also commercials, TV, local news, radio, Spotify, and you might say, but all of this is so expensive. The reality now is that this would be the time, especially with SAM, to go ahead and approach them because they are in the same boat. So they need to fill out and have some in-kind donations, and they are able to go ahead and provide some of those spots for free. Also public spaces, thinking through what places are still seeing people, and those would be your supermarkets, your pharmacies. We actually here in Ohio had our meetings with our directors, and our director of communication is creating a flyer with a QR code individually for each rape crisis center, and they're going to go ahead and put those out within the communities for those that need to access services. And that could be the gas stations, in those bathrooms, and as I mentioned, the grocery stores and the pharmacies. With companies that are doing meal deliveries nowadays, companies are still delivering food, and some potential partners can be Meals on Wheels, senior citizen services, the food banks, the schools, some specific restaurants in your areas can also do that. And like the local Kroger's or Giant Eagles or supermarket chains, even the Walmarts, that people are ordering their foods and or whatever they need for their groceries, and those are being put in the carts. They could go ahead and put that in the bags. Local service providers as well. Many communities are looking to the local health department as a central source of information. So I know that most of you are seeing every day a press release from your governor, from the Department of Health in reference to this. You can ask them to also mention either your state hotline or the national or the local coalitions, and they will be able to go ahead and speak about those services and mention it or putting it in the ad at the bottom of their page. Also training frontline staff to work with partners in local business and how it is important to recognize and being able to see if somebody needs the help. And by being creative, those are other ways. You know, people might not necessarily have the phones or the iPhones or the minutes enough to spend 3 or 5 hours getting an exam, but a lot of people are connected in social media or finding other ways to continue to be connected and communicated, and that is also a form to continue to provide the services and let yourself be known in the midst of COVID.
Thank you, Rosa. That's really some important specific information. Just to reflect on a couple of additional things I'm seeing in the chat. Back to the issue of the VOCA waivers, another thing I've heard a lot of programs say is that they've experienced a real intense, as you can imagine, falling off of volunteers who they may have counted on to provide some services, and so that they're having to pay staff to do things previously done by volunteers. I saw in the chat somebody talk about the fact that they needed more overtime pay for like their IT person and stuff. As you can imagine, I imagine IT people in a whole bunch of industries are being really taxed. And a couple of folks responded about the why if programs aren't seeing the increased demand now, are they anticipating in the future? And a couple responses to that. One person talked about how some survivors don't have privacy to reach out to seek services right now. And then somebody reflected on, and I'm not sure if this was to me privately, I think it was to me privately, so I want to go ahead and share it. Detectives are not at their desks to file reports, and in-person interviews, child interviews are being held off completely, so the boom will happen when they are back filing reports regularly and catch up. So just wanted to reflect on those items from the chat.
And can I just add on to that, Terry? Because I think what we're seeing is all of the, a lot of the criminal justice processes are just on hold. So cases are being continued into May at this point, and many law enforcement are digging out of backlog cases that they hadn't cleared out before, which is good. But we just, so that's part of, we're definitely in that group of thinking there's going to be a big wave.
Yes. Okay, so we're in our final few minutes of time together. If there are any additional questions, please send them in the chat or email them to me at tpoore@RALIANCE, that's TPOORE at RALIANCE.org. Know that our very specific asks for Congress right now in the next stimulus package are $100 million for the Sexual Assault Services Program, the VOCA match waiver, and the increased deposits for VOCA, and then special attention to the needs of immigrants and vulnerable communities.
Terry, do you mind, sorry, this is Ellen, do you mind if I add a little pitch onto that?
Sure.
Hi everyone, I'm Ellen Fern and I help out with policy here in Washington, D.C. And so for those of you who aren't our congressional staff friends on the webinar, I would like to urge you, as Terry said, to reinforce what we are asking Congress for in their ongoing legislation around COVID. And we have 3.5 now, we'll have 4, maybe COVID 5, but Congress needs to hear from us. Your local representatives, your senators, your representatives, their staff need to hear what challenges you're facing, why you need emergency supplemental support. It has been fantastic information shared on this call. And then that next step is to make sure your elected officials know what challenges you're facing. They do want to know. They are working hard to get money, federal dollars out the door. Is it perfect? No, but people are working fast and furiously. But we have to make that connection for staff in Washington, D.C. and elected officials, the connection between the impact of this pandemic on victims of sexual assault. As Terry said at the very beginning of this webinar, the fact that we can't report this huge increase in numbers, maybe to national hotlines, and some local hotlines are going up, some aren't. It's very nuanced. So it is up to you, and I hate to put more work on your shoulders, but they really need to hear from you and specific challenges. It is just so helpful. Elected officials just really need to be better educated, and they want to be educated, but this is where we depend on you to help us with that education.
Great. Well, thank you so much, everybody, for joining us. We're so thrilled to have so many of you on board. And thank you so much to our excellent speakers, to RALIANCE and Ebony for co-sponsoring this event with us for Sexual Assault Awareness Month, and for all of you in the work you do. So we're going to say goodbye now. I'm going to do one more check of the chat. Okay, well, thank you everybody for joining. Take care, stay healthy, stay well, stay in your house, and take care, everybody. Happy spring.
Thank you.